You may recall the recent high-profile surgical mistake where a local Kaiser surgeon mistakenly removed a healthy kidney and left the one with a cancerous tumor in place. But there are thousands of less dramatic but still serious surgical mistakes made every year. Here with further details is my guest, Dr. Martin Makary, a cancer surgeon at Johns Hopkins Hospital in Baltimore and author of the New York Times best-selling book, Unaccountable. Dr. Makary, thanks so much for being here.
Good to be with you.
Your book focuses on never events, as they're called. Give us a few examples of what never events were. You named a few in your book.
Yeah, these are things that are entirely preventable. Leaving a sponge behind, operating on the wrong arm, even operating on the wrong patient. Now, people should know, they shouldn't be alarmed. Surgery is safe. These are the extreme. But minor mistakes that harm patients occur 1 in 4 times in the hospital, according to the New England Journal of Medicine. So mistakes are common in healthcare.
And when you say minor mistakes, are you talking about 2 unnecessary surgeries? What are you talking about?
We're usually talking about getting an unnecessary test done, or an unnecessary blood test, or an IV that had an infection or something like that. These are not life-threatening, but these are minor, and they occur 1 in 4 times in the hospital, according to the New England Journal of Medicine.
All right. You and some other researchers identified that in the U.S., more than 9,700 malpractice payments over the 20-year period for this report. Among those, the most common never or catastrophic events were about 49%, or about half, of leaving a foreign object left inside a patient. About a quarter was the wrong procedure, another quarter operating on the wrong site, and then less than 0.5% or 0.3% the surgeons operated on the wrong patient. That sounds a little grim, but the American Hospital Association says that things are better now. Do you agree with that?
Well, as you know, we developed the checklist at Johns Hopkins to try to prevent these problems, and this checklist has been adapted by the World Health Organization and is used around the world now. So we're doing things that are better, but you know, downloading a checklist is not going to solve healthcare's problems. The culture of medicine needs to change. We've got an endemic of mistakes. Now, yes, these are the extreme, leaving a sponge behind, and we can develop better technology to engineer the problem out of the system. But medical mistakes are the number 3 cause of death in the United States. We spend a lot of time and energy on number 1, heart disease, a lot of time and money on cancer, number 2. Number 3, we're just now recognizing that it's a problem of this magnitude.
What do you think that hospitals, or I don't know, the AMA, are we protecting surgeons for profits? And so they allow these surgeons, let's say, who make numerous mistakes over and over again to continue practicing?
Well, we do know that there's very little external peer review in healthcare. Doctors groups now are standing up and saying we need to improve quality by measuring what we do using physician-authored definitions, so we don't punish doctors that take on high-risk cases. I'm one of those surgeons that takes on high-risk cases, so I understand. And we need to think carefully about measuring this problem. Any business CEO says, why don't you folks in healthcare just measure the problem in order to figure out the solution?
Tell us why in your book you mentioned that massive fines might help the situation.
Well, it turns out that when things are out there in the public, hospitals respond quickly. When there's incentives and a hospital is a bad outlier for infections or readmission rates or something else, then they respond. They put a lot of resources into the problem, and they come to the doctors and nurses on the front lines at their hospitals, and they say, what do you need to do your job better and get this problem fixed?
Certainly fines helped in HIPAA laws, because everybody knows about HIPAA laws and has experienced that. But when it comes to getting the information about, let's say, hospital mistakes or surgical mistakes, we found it very difficult trying to get per hospital list in San Diego. We were told they don't compile them. California Public Health Services said, unless you put in a public information request. How can patients get this information?
I mean, you have to, it's no surprise I'm hearing that you have to essentially donate a kidney and give up an arm and a leg just to get some information from these state health departments sometimes. You know, I believe the public has a right to know about the quality of their hospitals. You have more information about the restaurants you go to than you do about the hospitals you go to. And there's no reason why we can't put some of the information that's already collected in the national clinical registries, often funded by taxpayer dollars, up on the web for everybody to see. We're talking about basic stuff. infection rates, readmission rates, risk-adjusted complications, never events like these complications.
Please give me maybe the top 3 things patients can do to protect themselves, aside from information. Should you write on the leg that you're getting operated on? What can we do?
Well, I think the most important question a patient should ask is, what if I don't have this done? What are the alternatives? And get a second opinion. You know, 30% of second opinions are different from the first opinion. There's some good websites we go through in the book Unaccountable. Hospitalcompare.hhs.gov, consumerreportshealth.org. These are good brands that are housing solid data for patients.
All right. Unfortunately, we are out of time. Dr. Makary, thanks so much for talking with us.
Great to be with you, Peggy.